Have you been told just get pregnant or it's just period cramps? Take a pill and you'll be fine. Unfortunately, when it comes to endometriosis, there is a lot of bad advice out there. It can delay diagnosis and it can leave you feeling dismissed. In today's video, I'm going to go over the 5 worst pieces of advice for endometriosis and explain why they are wrong. I'm Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist helping people with endometriosis for over 20 years. And I know how invalidating and confusing the journey to diagnosis and treatment can be. If you've been struggling with pain and infertility, or you just want clear answers and explanations, you are in the right spot. If this is your first time finding this channel, welcome. Be sure and subscribe so you get my weekly videos all about reproductive health. And if you are coming back because you found information valuable, welcome back. I am so glad that you're here. There are 2 other ways to learn from me and stay engaged. Number 1, you can sign up for my weekly newsletter. Link in the description below. You get up-to-date fertility news and recommendations. And the second way is my weekly Brave and Curious podcast. You can listen anywhere you listen to podcasts. Now, today we're talking all about endometriosis. I'm going to give you a reminder and a definition of exactly what it is. And I'm going to share with you the 5 worst pieces of advice that people can get about endometriosis and why they are wrong. Let's get started. First of all, what is endometriosis? Endometriosis is a chronic inflammatory condition impacting 1 in 10 women reproductive age. It often presents with pain and sometimes infertility, but it can go undiagnosed for years. It's a presence of this tissue that is usually only found within the lining of the uterus or the endometrial layer of the uterus. But that tissue is found outside of the uterus and it causes symptoms. So if this tissue is found throughout the pelvis and on top of the uterus, on top and within the ovaries, and really throughout the body, people can have symptoms of pain, bladder symptoms, bowel symptoms, fatigue. It's a chronic inflammatory condition, and it can be so confusing because really the gold standard for diagnosis is seeing that tissue, and that requires a laparoscopy or a doctor putting a little camera, a little scope through the belly button and seeing lesions outside of the uterus. And surgery comes with complications and, trying to get it scheduled. And it's just not easy to just get a surgery done and get this diagnosis. But there can be strong suspicions of this. It can run in families. People can have very clear cyclical symptoms that are worsening around the time of their period. But because it's not easy to diagnose, because people are often taught to dismiss their symptoms, and that it's just okay to have significant pain, it can really be a delay of diagnosis and a delay of treatment, and a lot of bad advice can be given to you along the way. Here are the 5 worst pieces of advice about endometriosis that I have heard from my patients and my friends and honestly my family members. So here we go. Worst advice number 1, just get pregnant and your symptoms will get better. This has been common recommendation and advice for decades when it comes to painful periods that are often due to endometriosis. People can feel dismissed by their doctors that just sort of say, oh, get pregnant and all your symptoms will get better. And I feel like this comes from a lot of different kind of rationales or reasoning. Certainly, when you are pregnant, you are not having menstrual cycles. There aren't the big swings in hormone changes. And so people won't have pain with periods because they aren't having periods. And there are people that do sometimes report that their periods get better after delivering a baby. But what if you aren't ready to have a family or you never want to have a baby? Just telling someone that they should just get pregnant in order to feel better is very dismissive. I actually learned that my mom got this advice in the 1960s. I interviewed her on my Brave and Curious podcast. It was episode number 56. Go back and listen to it. She's an amazing woman. She's honestly a hero of mine. But she talked about her own fertility journey and how she had extremely painful periods growing up and in her young life, and that doctors often told her, well, just get pregnant, and as soon as you have a baby, you're going to feel much better. And this was the 1960s, and I have had patients who have been told this exact same advice by doctors in now the 2020s, and it can be dismissive. It's not always correct. A lot of people don't have a change in symptoms after having a baby, and we just can't assume that that is a life goal for everyone. So I categorize just get pregnant to treat your painful periods and your endometriosis as bad advice. Worst advice number 2 for endometriosis, it's just period cramps. Stop complaining, take a pill, you'll feel much better. Wow, talk about gaslighting, talk about feeling dismissed. I hear this a lot from my patients. At a new patient visit, I'm eliciting a lot of history and I'm asking a lot of questions. And sometimes I'll just ask, tell me about your periods. And people will sort of say, oh, yeah, I have, cramps, but it's just kind of always been like that. And, and then just sort of want to go on with the conversation. And I have to sometimes really dig it out from people. I'm like, well, what does cramps mean to you? And when people say, oh, well, I know that a couple days out of the month, I'm going to miss school, I'm going to miss work, or I'm popping, Motrin, Advil, whatever over-the-counter pain medication, every couple of hours. And I'm still, missing things that I enjoy in life. Or I'm on the bathroom floor, nauseated and throwing up from the pain. This is not normal, but I've had so many patients that have been told time and time again from their doctor or even from their own family, oh, that's just periods for our family, no big deal. We all just kind of suck it up and deal with it. I appreciate that. I understand that. I think people are just trying to help each other, but that is not normal. And oftentimes I'm eliciting this and people are like, well, I wasn't really going to tell you because every other doctor I've said has just kind of dismissed it as, it's kind of fine. So pain that takes you away from things that you enjoy, pain that is associated with nausea, vomiting, significant bowel bladder changes, pain that is not relieved by over-the-counter medication taken in the directions on the bottle. There's a reason you're not supposed to take too much Tylenol or too much ibuprofen in a 24-hour period. And if you are ignoring those recommendations and still in pain and taking way too much, that is not okay. And just to tell someone it's just period cramps, no big deal, just deal with it, that's the worst advice. That is bad advice, number 2, for endometriosis. That's one of the many reasons there can be such a delay in diagnosis of endometriosis. On average, it can take women 7 to 8 years between onset of painful symptoms and actual diagnosis and treatment because they feel dismissed or they are not listened to. Worst advice number 3, a hysterectomy is going to fix you. Wow. Okay. I get it. First of all, I got to clarify, a hysterectomy is a surgery to remove your uterus. And so, yes, I could see the logic that removing the uterus, you no longer have periods because you're not building up a uterine lining and shedding it every month. And so therefore you must stop having pain. But that is a drastic recommendation. Certainly if you have a hysterectomy, you cannot bear a child in the future. Of course, there are other options. Someone could create embryos with IVF and then use a gestational surrogate to carry their child. But gosh, hysterectomy is a very drastic and definitive treatment that you can't take back. And unfortunately, it doesn't always fix the symptoms from endometriosis. There's an excellent review article on endometriosis, research, treatment, options, a really great review in JAMA that came out in 2025. I'll make sure and link the reference in the description below. And one of the things that it talks about is hysterectomies for treatment of endometriosis symptoms. The authors conclude that hysterectomy can be a surgical intervention to help treat symptoms of endometriosis if initial treatments like less invasive surgery, maybe just removing lesions or using hormonal treatment or other medical treatments to try to control the pain. You can consider a hysterectomy as a treatment for endometriosis. However, 25% of patients that do a hysterectomy for endometriosis symptoms go on to still have symptoms after the uterus is removed. And 10% of these patients go on to have additional surgery in the future, like removing lesions and scarring and more. So to say definitively that a hysterectomy is going to definitively 100% treat your endometriosis lesions, that's just not true for everyone. Worst advice for endometriosis number 4, if birth control doesn't work, nothing else is going to help. Well, that's not true. Listen, birth control can be an amazing treatment option for people with endometriosis, and it's often first line offered to people. You know, the dominant hormone in birth control pill is progesterone. There's a little bit of estrogen, but it's dominantly progesterone. Estrogen inflames endometriosis and progesterone quiets it. And the benefit of birth control pills is honestly just continuous progesterone exposure can really help people's symptoms. People can have relief of pain, they can have lighter periods, and really honestly start to feel better. But just like with any intervention, can be side effects with the birth control pills, and it might not work for everyone. So just to say that birth control pills is the only treatment option, and if it doesn't work, there's no other options, that is just not true. There are a lot of non-hormonal medications that are available for endometriosis pain, and surgical intervention with an experienced pelvic surgeon that does excision treatment for endometriosis. A lot of people can feel a lot better after that surgery. Of course, not always, but again, just to say that birth control pills are your only option, and if they don't work, nothing else will, that's just bad advice. I have lots of educational videos here on YouTube about endometriosis where you can look into alternative treatments and other options. I even include lifestyle optimization treatments. There's some evidence that decreasing exposure to endocrine disruptors like plasticizers, BPA, phthalates, that can actually sometimes help people feel better because those endocrine disruptors act on the lesions like estrogen. Remember, estrogen inflames endometriosis, progesterone quiets it. So sometimes people cutting out a lot of toxins and chemicals and cosmetics and laundry detergents and lotions that have endocrine disruptors can often feel better. Sometimes diet can improve endometriosis. Exercise can improve it. There's lots of different things that someone can do beyond just birth control pills. 5th worst piece of advice about endometriosis: you can't have endometriosis. The imaging is normal. So this is pretty common. I've had patients come to me who have shared symptoms with previous providers. I'm often the 2nd, 3rd, 4th opinion. And oftentimes people have been told by previous providers, I did an ultrasound, I did an MRI, I did all of these imaging studies, and there's no evidence of endometriosis, therefore you must not have it. Now, that's just not true. Some people have significant endometriosis, but it doesn't show up on an MRI or an ultrasound. Sometimes you can see it, especially if there's a collection of endometriosis within the ovary that's called an endometrioma. So sometimes you can get suggestions of endometriosis from imaging, but normal imaging does not rule out endometriosis definitively. Some of the worst cases of endometriosis that I have experienced in my patients are when the doc looks in, the pelvis is full of endometriosis and adhesions, but the MRI was completely normal. So you just cannot assume that because you can't see it with imaging that it doesn't exist. So in conclusion, if you have heard even one of these horrible pieces of advice for endometriosis, you are not alone. A lot of people have heard this. This is why it's important to learn and advocate for yourself, and do not be afraid to get a second opinion. You should not be suffering, and find that person who's going to listen to you and help you with your symptoms so you can live your fullest life. I hope you learned something today. Like this video if you learned something. Comment with questions that you have or other topics you'd like to see covered here on this channel. And be sure and subscribe to this channel so you don't miss my weekly videos all about reproductive health. Don't forget about the newsletter, and definitely check out the podcast. I've got a whole playlist here, the Brave and Curious podcast, where you can watch the videos of interviews, and you can also listen audio anywhere you listen to your podcasts. Until next week, wishing you love, luck, and pineapples.